जेनेटिक डिजीज़ को इस तरह प्रिवेंट किया जा सकता है कि आप मैरिज जो बच्चे हैं जिसको एक डिजीज़ है लाइक क्विल्सन्स है, वो क्या उसका डिजीज़ है, जब वो कैरियर है, दे शुड नॉट गेट मैरिड विद इन द फैमिली. दिस इज़ हाउ वी कैन प्रिवेंट टू सम एक्सटेंट. बाकी जो डिजीज़ है, इन्फेक्शंस हैं, दे आर प्रिवेंटेबल ऑफ कोर्स. जो हेपेटाइटिस ए है और ई है, दिस इज़ ट्रांसमिटेड बाय ओरोफिकल रूट. लाइक we eat from outside, it's infected water, infected food from from different sources, so they can cause hepatitis A or hepatitis E, and they can lead to jaundice and everything. And other source of infection is blood secretions, which is very common, like in hepatitis B, C, and these are preventable. Even orophycal route, if we are taking hygienic food, clean food, we can prevent these diseases, and we should always be very careful. Take boiled water, clean water, and do not, usually we advise not to eat outside, which is very, people don't accept it. They just go and eat out from anywhere they like. And B and C is the source is secretion and blood. How this is spread is by use of the syringes, use of blades, use of needles, and use shaving kits. Where people, they share their shaving kits, and they share their razor, they share their combs, they share their nail cutters, and when they go to the shops for shaving, and they don't care with these things. I mean, and it's a lot of quacks and periphery in the dispensers in the peripheries. They still are not using disposable syringes, or though we have not disposable syringes, and we should be very strict with use of the disposable syringes, and we should always dispose of all the needles, blades, whatever we use in our hospitals or in anywhere. This we should dispose them of. In Shifa we have sharps bin, which is put in every department, and we are collecting all these utensils in there, and then we dispose of them, and we dump them somewhere else. So this is very important to, even these diseases are transmitted by sexual involvement, so we should be careful with that. If a person gets infection in the family like B, they should get family vaccination. The person who has infection because of hepatitis B, he is not supposed to get vaccination, but his children, his wife, his rest of the family, they should get vaccination. This is called anti-cancer vaccine, because hepatitis B, once if it progresses to chronicity, this can cause 𝗙𝗹𝗹𝐶. Once we are vaccinated, we are most of the time chances are we will not get hepatitis B. There are tests with which we can confirm that the immunity is there, and we are immune to this hepatitis B infection. For C, we don't have any vaccination still. But for C hepatitis, how we can stop its transmission is that when a patient is given treatment, he or she should be advised that they should get whole of their family checked for hepatitis C. They should check for hepatitis B and C both. And hepatitis B, for B, they should get vaccination, and for hepatitis C, they should get early treatment if they are proved to have active hepatitis C infection. Because nowadays treatment is not very expensive, and it's very short term. In the past we used to get these treatments which are very expensive. बहुत ज़्यादा कीमती टीके लगते थे. Patients used to run away from the injections. There were a lot of side effects, or weakness, and aches and pains, alopecia, and multiple problems. But now with the new research, we have drugs which are effective within 3 months. They become negative, and then it is prevented and fair. So when we are treating hepatitis C, we are preventing cirrhosis, यानी जिगर का सिकुड़ना. वो सिकुड़ेगा नहीं, उसके फंक्शंस कायम रहेंगे, आपकी बॉडी ठीक रहेगी, आपको जॉन्डिस नहीं होगी, आपका पेट में पानी नहीं पड़ेगा, आपको उल्टियाँ नहीं आएंगी खून की, आप बेहोशी की कैफियत में नहीं जाएंगे, एंड यू विल नॉट गेट कैंसर, और आपको ट्रांसप्लांट की ज़रूरत नहीं पड़ेगी. Transplant is the last modality. It's not just a game. that we will just go for transplant. It's very expensive, and it is though it's very effective for those who we don't offer them any other treatment. We can't offer them any other treatment, but then they are advised liver transplant. But it's not easy. It's not easy to get a liver. It's not easy to expand for this cost, to bear the cost. जो इतनी ज़्यादा कॉस्ट है, लाखों में है, 50 to 60 lakhs or 70 lakhs or maybe more than that. And then after transplant, complications and care and this and that.